Welcome, Deanna, to the Dental Hygiene Basics podcast. So excited to have you on. And we have to give a shout out to RDH Under One Roof because we are recording on the exhibition hall floor right now. And it's buzzing with energy, very exciting stuff. So, Deanna, the first question I ask all of my guests is, tell me how you got here. Tell me about your RDH origin story. What led you to a career in dental hygiene?
Yes. Hi, Dana. Thanks for having me, and how exciting that we are here. This is my home state. I'm from Texas. I used to live right down the road, so coming back home is a joy. So welcome to Texas, everyone that's listening. How did I get into dental hygiene? So I was a former Marine. I went into the military right after high school. I kind of had a tough time in high school. I was not a good student. I was an A and B student. I didn't know what I wanted to do in college. I didn't even know if I wanted to go to college. So I joined the military. I knew that they were going to pay for my college. And when I got in, I was going to be a career lifer. I was going to stay in there. I was going to fight the battle. And then September 11th happened. And so I did one tour in Iraq as a Marine. I was a truck driver. So that was exciting. People ask me all the time, did I clean teeth in the Marine Corps? Well, no, the Marine Corps does not have any medical or dental sectors. It's all provided by the Navy. We're under the Navy. So no, I came from being a truck driver in the Marine Corps, and I did 4 years and got out, and I went to Texas Women's University. It was a beautiful 4-year college, and everybody picked a degree by just running down the line of degrees that they offered.
Oh my gosh.
Yes. I'd always been told that I had beautiful teeth, and I thought, why not? I mean, and it ended up working out gloriously because look at me now. I mean, all the things that have happened that, has led me down this path and to be where I'm at right now. Yeah, spent 4 years, got my bachelor's in dental hygiene from Texas Women's, and I loved it. Practiced clinically for a long time. I still practice clinically 16 years later. Ended up getting a master's degree in 2020. It's just opened a lot of doors for me. And this career, it can be whatever you want to make it. Absolutely whatever you want to make it.
Absolutely. I know. I couldn't agree more. Obviously, we're here. We're meeting all of these incredible people at RDH Under One Roof. And you have these conversations and you're like, so where do you work? And the first question a lot of people ask is, where do you practice? And then it's fun to be able to tell the story. Well, actually, I don't practice like that anymore, right? Yeah. Well, I practice one day a week doing this, but all the other days, what am I up to? And I know that you do still practice, but I don't like to say just practice because practice is a cornerstone of who we are as dental hygienists. And I have also mentioned that, I love being a dental hygienist so much. My passion is education, but being away from the op for too long, I feel like I've lost a part of me. So I still have to maintain that one day a week with the patients in some regard. So, when we say just this or I wanted to do more, just know that we never lose that part of ourselves, right? Yeah.
Absolutely. Like I mentioned earlier, I am a Texan, true and true. I loved coming back home. It was only a few months ago that I moved to Minnesota. So it's the same thing. Like I love coming home. I love getting back in that chair. I love popping off that lower anterior calculus. I love talking with patients. I love using my instruments. Like it is truly the cornerstone of who I am.
Yeah.
And I'm so proud to have that career choice. I've also decided to move beyond the chair. So I work in the infection control space. I like to talk about dirty things, and I teach CEs on OSHA and infection control. I dabble in a little bit of HIPAA and cybersecurity, but I leave that to the other experts in the room. I think infection control is really important, and sometimes it's overlooked and just seen as a necessary thing that we just have to do to get through, to do our jobs, to put our gloves on, to protect ourselves and our patients. But I find it truly fascinating, and it's really, really important to me, and it's important to protect our patients and our community and ourselves, because if we're not healthy, how can we provide that ultimate care for our patients?
Absolutely. Yeah. And all of this coming from, you were a truck driver in the Marine Corps. I love that. Thank you for your service. And, it's like you look down the long path and sometimes we don't see from point A to point B, but we end up where we're supposed to be. And where we're supposed to be is not always just the end of the journey, right? It continues on, and there are experiences that are available. And I love infection control. I taught pre-clinic, and I was like, oh my gosh, queen of infection control. I'm the one like across the clinic at school, like, hey, what are you doing? Don't touch that with your gloves.
Don't touch it with gloves. Exactly.
So that is really one of the foundations of dental hygiene school is
Mm,
really, really taking to heart the infection control, right?
right, right.
Okay, we're going to go off script a little
Okay,
bit. I know
let's
I
go.
told you we were going to talk mainly about dental hygiene school and things like that, but
Yeah.
what do you see are some of the biggest issues in infection control that had a student learn this earlier, maybe could have prevented some issues down the line?
Really? Okay. Hand washing is really, I mean, it's so basic,
Yeah.
but I see a lot of clinicians that are still not washing their hands or
Hmm.
washing their hands properly. Applying hand sanitizer when you're supposed to, before you put your gloves on, after you take your gloves off, you've got to be washing your hands.
Yeah.
And then PPE, wearing the proper PPE. In dental hygiene school, I mean, we stretch it out to the nines,
Yeah.
right? We do the whole thing. I mean, short of a NASA suit flying to the moon. And when we get out and meet seasoned hygienists and we go into offices that are a little bit more lax than how they were in school, then we think it's okay.
Yeah.
That's not okay. We teach those things to the students in school because it is so fundamental. It's not about protecting yourselves. Well, it is about protecting yourselves, but it's also about protecting your patients. And then remember, your patients are going back out into the community. So if something happens and you transfer something to that patient or something happens to you, you're taking that home to your family. You're wearing those shoes into your house. You're wearing those dirty scrubs that you didn't cover up with a lab jacket or disposable gown into your house. You're picking up your kids from school, and then your kids may be getting sick and then they're putting their hands in their mouth. It goes a long way. Those bugs travel far. So hand washing is a big deal to me. Wearing appropriate PPE like you're supposed to. Why are we not wearing eye safety glasses? I mean, yes, I see them on patients sometimes, which they should be all the time, but why are clinicians not wearing safety glasses?
Yeah.
I think I'm so glad that, these schools are really pushing these loops for these clinicians now. But I still see providers that are not wearing safety glasses and there's stuff flying through the air.
Yes. So just for some random perspective, prior to going to dental hygiene school, I worked in surgery. So I was a surgical assistant in an oral surgery office. And that's where I learned infection control. And you had to be on it, right?
On it.
Because, I mean, we were looking on the walls, the ceilings for blood, right? Cleaning
Yes.
everything because it's surgery. And I learned a lot about infection control there. And I'm really glad that was the start of my career. But the one thing is, they said you have to wear eyewear. Well, I was just wearing classic glasses, no side
Right.
chills, anything. And I don't know if I ever really cleaned them. But later I was looking at them and I saw that there was a blood like in the rim. And I
Mm,
did not have anything protecting the top, bottom, sides of my eyes.
right.
That is super scary. I mean, diseases are transmitted in blood, and our eyes are a perfect vessel to receive them.
Absolutely. I remember having a teacher in hygiene school, and she was teaching. Well, she was practicing back in the 80s, and she told us a story that she had an HIV positive patient in the chair, and she was doing a procedure, and there was some blood splatter, and it actually went into that area between your nose and the side of your glasses where she entered into her mucous membranes and she got an exposure. That is an occupational exposure. And so she had to go get tested. She didn't end up with HIV. But I mean, our jobs are serious.
Yeah.
Our jobs are very serious. And I wish more clinicians took it a little bit more seriously in the infection control space because you would never take your loved one to a hospital and watch a nurse not wash their hands and then put an IV line in.
Yeah. And
You
if they do, you should say something.
Exactly. And I would hope that you would want your patients to see that same perspective when they come into your office, to your clinic, to your school, and experience that same type of cleanliness, infection control measures, all those things.
To me, that is the first sign of building trust. I mean, you walk out, you introduce yourself, you should be friendly, kind,
Sure.
make sure they feel loved, taken care of, just like you're taking care of your family. But next step, wash those darn hands,
Yes.
right?
Let those patients see that you're opening up sterile instruments.
Yeah.
Those instruments should not be laying on your tray
Hmm.
open. I always have this little thing. I think little gnomes come in your offices at night when you shut down and they mess with things. I just have this vision in my head like there's gnomes dancing on those instruments and trays that were left open at night.
Yes. And this is the thing too. You mentioned we graduate and then we go out and we see what our other hygienists in our offices are doing. And to us, they know more than us. They're mentors.
Right.
And for some reason, I have not figured out why,
We get away
yeah,
from
why
that.
we get away from that. And I think it's something about you feel like, oh, I was in school, like I had to do that because it was
Right.
like almost like a form of punishment or something. And then I
Yeah.
get out and now I don't have to do that. I can wear the long nails and I can do
Yeah.
this and that. And it's like all of that was rooted in research for a reason to protect you And
Right.
if you're not concerned about yourself, you have to be thinking patient first.
Exactly.
Absolutely.
Exactly.
Yeah, I have so many instances. I mean, I had a friend of mine who, had the Cavitron or the powered instrument sticking up and
Mhm.
didn't have a protector device, and it caught her
And it caught
hand.
her hand.
And the
Yeah.
patient had a communicable disease, so she had to go and get all the testing and take all the medication. And those things can be easily prevented.
Gosh.
I'll tell you my hot button infection control.
Tell me.
I think I have at least two. The first one is when everyone puts their PPE on, washes their hands, but puts the gloves on first and then puts
And
the
then puts the
eyewear on.
eyewear on.
That
Yes.
just like baffles me because I'm like, no, no, no. The gloves are the last thing that goes on.
Yes.
And then you have robot arms. They can go to the right to pick up your patient, or if you're left-handed, opposite, and then
Right.
they can turn the opposite way to go in your patient's mouth. They can touch a barrier,
Yep.
but that's it.
That's it.
So if you're typing
That's
on
it.
your keyboard without a barrier, if you're touching anything, your
Opening
glasses,
drawers.
yes, all of those
Yeah.
things.
Messing with your hair.
Bonkers.
Oh, wait, if you got gloves on and you've got to get your hair out of your eyes, hair should not be in your eyes anyways.
Yes,
It should be
all
up.
be pulled back and preferably covered. Yeah.
I used to work in an office where this beautiful young assistant, long blonde hair, she would work with a doctor. She was beautiful, just how assistants like. I love assistants.
Yeah.
But sometimes the high-speed suction would catch her hair and it would get caught. It would suck up her hair and then she'd pull it out and, there'd be blood on there, saliva.
Oh my gosh.
Like, how are you, come on, let's get with it.
Just tie
Let's
it
get
up.
with tie it
Yeah.
up.
And I get it because I went to school in San Antonio, and shout out to UT Health San Antonio. Woo woo. Love the school, love all the training I got there. But it was, and I didn't know this, but it was originally, when the people came in and were starting these programs, heavily military influenced.
Yes.
So we all felt that things were very rigid, cover up all the tattoos, all of that. But our hair had to be slicked back in like a bun,
Yes,
right?
yes.
And we had to have on the bonnet and everything. I remember everyone being like, this is too much. Like, this is restrictive.
Right.
I'm like hairspraying down my little flyaways.
Yes.
But honestly, when you hear stories like that, it's like some of these rules are for a reason. Do I
Yes.
think your hair needs to be slicked back? No, but
No.
I do think it needs to be covered.
Right.
And I always tell my students, I'm like, listen, when you're in the chair and you're using some type of instrumentation or air, water spray, whatever, that's creating these little tiny aerosols, these particles, they're floating
Yes.
around. And where do they land? In your hair.
Absolutely.
And then you go rub your head on your car seat.
Yeah,
And
exactly.
if you're like me and you don't wash your hair every day, it's
Right.
all on your pillow.
Exactly.
Yeah.
Exactly. And pick up your kids from school and you're hugging on them and you may go visit your sick grandparents. I mean,
Yes.
that stuff travels.
It does. We have to think about that. So, I know that it's a passion of mine because I taught infection control and bless my students' hearts. They knew I was going to be on top of it. But even when I got out into practice, there were some things that I let slide sometimes.
Absolutely. Me
Yeah.
too.
Yeah.
Me too. I didn't get into infection control until just a few years ago.
Mhm.
So I was one of those hygienists that,
Yeah.
I'm out of school. I don't have to do that. I'm hot. I don't want to wear my lab jacket. All those things.
Yes.
We're
Yeah.
all guilty of that.
Yeah.
So.
But I think if you put it into perspective, the importance of it, and I know for me, like my first 2.5 years, I wore a hazmat suit. I had my head covered. I did all the things. The only thing I didn't wear was a shield. And that's just,
Sure.
now I'm
Boots.
team shield.
Right.
You can't even tell who I am when I have all my stuff on, but
love
I go into elementary schools. I'm working with kids. I might
Yes.
see 15, 25 kids, whatever. And I'm like, they're all coughing and
Yes.
putting their hands in weird places and then wanting to touch you.
Right.
Yeah. So, I'm like team infection control, but there was a time where I maybe I'm not going to wear my head covering
Of
today,
course,
or
of
instead of a
course.
gown, I'm just going to wear my little lab jacket. And
Right.
it was actually funny. The first 2.5 years of practice, I never got sick. And then the second 2 years, I was getting more sick. And I was like, I think that there is something to be said about changing up my infection control standards a little bit. So-
Wonderful. Well, thank you for sharing that.
Yes. Yeah. I think it's just an important conversation. One I've actually never had on the podcast. So this is very exciting for me. Yeah. So
Right.
thank you for your perspective. So I want to just say, you're at Texas Women's, you're in the dental hygiene program.
Yes.
What do you feel like was the most difficult aspect while you were there?
Oh my goodness. So because I went into hygiene school after the military, I was a non-traditional student. I didn't go right after high school or after, you know what I'm saying?
Yes,
I went in.
yeah.
I had to work. I worked 2 jobs, one on
Mm.
the weekend and one at night, and went to school. I didn't have parents that paid for my college. And bless y'all that have wonderful families that can do that. Or if you have, y'all can do that on your own. But I had to work. So that was really difficult because I would sometimes get to school 2 hours early so I could get like an extra hour of sleep before school started because I was up late the night before. That was difficult. And then there were some professors that felt like I was making the wrong decision by doing that,
Mm-hmm.
that I needed to focus more on dental hygiene school. Well, I ended up graduating near the top of my class.
That's incredible.
So, I mean, it can be done. You have to do what needs to be done to get through to reach the goals that you want to reach.
Yeah.
But I think more your question was like, what were some of those difficult things that I encountered during school? Oral pathology kicked my hiney.
Yeah.
Oh my goodness. We had a seasoned dentist that taught the class, and he'd been teaching it for probably 30 years. And it was really difficult for me.
Yeah.
Yeah, I struggled with that. But I tell you what, I love radiology, and there are some people that can't stand it.
Yeah. I was not a radiology fan until I taught it. But for me, it was the hands-on aspect, like taking the radiographs.
Yes.
Even though I had been an assistant, I was never trained on that and the
Yes.
techniques. And it was so funny. Every week I'd turn in my x-rays and so they'd say, you need to work on this. So the next week I'd come and I'd correct that, make a totally different error.
Sure.
It was totally unpredictable. And I was like, I am shockingly inconsistent with my errors. Like it's not
Right?
the same one over. So I'm glad you loved radiology.
Yes. But once we got to that point, we were inside the clinic and we were working on patients. I was like, this is really neat.
Yeah.
I was so nervous to go subgingival the first time. Aren't
Yeah.
we all though? Like,
Yes.
I'm hurting the patient. I'm hurting the patient. No,
Yeah.
you're not. You're not. Get down there, girl. Get it.
I know. And if you're listening and you're like, what does subgingival mean? It means you're going below the gum. So
Yeah.
if you thought your life was going to be just cleaning what you can see in the mouth, absolutely not. We're using primarily feel and you're exploring like in the depths of the ocean. You don't know what's down there,
Yeah,
right? It's like going
absolutely.
fishing.
It's like blind. You're doing it blind.
I love that. So you're in oral pathology. It's just kicking your butt. Do you have any tips? What helped you get through it? Do you remember?
That's when I really started getting a study buddy, a partner or 2 or 3 of us. And we made a plan to meet once a week.
I love that.
And we held each other accountable and we shared notes and we shared study material. And it was one of the first times that I didn't just go home and felt like I had to study on my own and grasp it all on my own. So I really utilized my team members, my cohorts.
Yeah.
And it was like the next semester we did that with another class as well. Don't always feel like you have to do it on your own. Reach out. If you need some extra training or some extra time or you want to talk to your professors, utilize them. They are the experts. They're the educators. So don't feel hesitant to go ask them questions and don't hesitate to ask your friends and your neighbors because they could be struggling too.
Yeah.
So I do actually really remember that being so impactful because I'm very independent. Sometimes we don't want to ask for help.
Yes.
Oh, I can do it. I can do it on my own. I got it. But there are some times when you need to lean on other people and that's okay.
Yeah.
That is okay.
No, I agree 100%. I mean, I read this in a book the other day and I was like, that is me to a T. It's like, you love to learn, but you hate to be taught. So I listened to my teachers. I absorbed what they said and I definitely respect them very much. But there were some things I thought I'm by myself. I can learn this on my own. And then you come to something and eventually you're like, how long do I want to spend trying to figure this out when I could just ask the question or hear it from someone else's mouth and it will click and make sense, right?
Exactly. Exactly. So
yeah.
even now, I just want to say real quick, even now that I've been practicing for 16 years and I'm not in the operatory every single day, there are new things that are coming out all the time that I just don't know.
Yeah.
And I am comfortable enough to know now that I can ask colleagues, tell me more about myofunctional therapy because I don't know anything about it. I don't want to claim to be an expert in that space because there are others that are experts in that space.
Yeah.
So even when you graduate dental hygiene school and you have learned all the things and you have taken all the boards and you have that license hanging on the wall, it's okay if you don't know everything.
Yeah.
It really is okay. So reach out to old school buddies and reach out to those seasoned hygienists because some of them do want to mentor the young ones. We want everyone to be successful hygienists. We really do.
I agree. I mean, it's just something I see repeated over and over. Anytime I ask someone to be on the podcast and they're like, what are we talking about? I'm like, well, basically a former version of yourself. How do we help these students?
Yes.
Right. And something that sometimes we forget is there was a time when all we wanted was to become a dental hygienist, right?
Yes.
Like, can you reflect back on that part of your career where you thought that was the end goal and then look at all you've gone on to do now, right?
Yeah. Just like I mentioned my story before, when I was in the Marine Corps, I thought I was going to make a career out of it. Then things happened. September 11th happened. I did a tour in Iraq. I went to war and I thought, okay, maybe that's not for me. And then same thing for dental hygiene. Like, oh, this is it. Like you're making the money, you're living the life, you're carrying the nice purse and driving the nice car. But then there is other things out there
Yeah.
too. Like you said, hygiene really is the cornerstone and it will always be in my heart. Like I live and breathe as a dental. I mean, look at all my pins on my badge, like all my hygiene pins.
Yeah, no one can see it,
I
but she
know.
stacked her lanyard from the conference is just like covered in pins.
In
Yeah,
dental pins.
I love it.
But, you know, you can always do more if you want more. There's
Yeah.
always more available for you. So I felt an itch to go back to school. I love learning. So I wanted to go get my master's. That's just a milestone I wanted to reach.
Yeah.
And I did that. And it opened up doors for me. So, you know, I'm a published author. I'm a speaker. You know, I teach CE courses. I'm on podcasts now.
Yeah.
Don't ever feel like you have to be in a box, that
Yeah.
you're stuck in that box, cleaning your patients day in and day out. If you want more, there is more. And here's something that's available to these youngsters now. The social media.
Yes.
Get on social media. If you're interested in following, there's all sorts of influencers in different spaces, different facets of dentistry and dental hygiene that you can follow that are doing wonderful things. You get all sorts of ideas from people that way.
No, I mean, when we think about, you said getting on social media and you can essentially just see all of the hygienists doing these different things. And
Yes.
that's one thing I try and talk about is you may realize that there's something very specific about dental hygiene that really intrigues you.
Oh, yeah.
And you can make a whole external career out of just that one thing. Like you're doing infection control, which is
Yes.
highly tied to dental hygiene, right?
Yes. But then we've got those hygienists that want to focus like on perio and they are
Yes.
like in it and they know how to say all those bugs names and everything. And, you know, those are the people you refer to for your expert advice. And those are the people you learn from.
Yeah.
And they're hygienists just like you and me.
Mhm.
And like the rest of y'all that are in school. And, you know, there are so many things out there beyond just cleaning your teeth in your box every day.
Yeah.
And there's nothing wrong with doing that as well, because you know that you're providing excellent care for your patients.
Well, and there's so many ways to expand within the op.
My gosh. Yes, absolutely. Be a leader in your team.
Mhm.
Be a leader in your office. I mean, bring in new ideas,
Yeah.
ways to learn. One of the things I learned, and I don't know if you're familiar with this, is Lean and Six Sigma.
I've heard of Six Sigma, but are they tied together?
They're kind
I
of
was
tied
like, yeah, I
together.
was
Two
like,
different philosophies, but
Yes.
they're tied together.
Okay.
It's a way of working physically in your operatory that reduces stress and strain and making workflow patterns easier.
Love that.
So I mean, just little things like that, because even in your office, you can change coworkers' lives too. You know, that is your second family that you'll learn about. You're going to
Yes.
spend more time with them possibly than your regular family that you go home to every day. You know, value those friendships, value those relationships, be willing to lift those people up, and then also bring in ideas because, like I said, you could change someone else's life that's working in the operatory right next door.
Yeah. And there's even within the office, as leadership, you're supposed to have an infection control specialist.
Absolutely.
There's someone who
Yes.
there needs to be a protocol in place. And so that's just one little tiny
One little thing.
that you could do that sets you apart. You add it to your resume. It helps you to learn and
gosh,
grow. And the next thing you know, like where does life take you from that one thing,
Right.
So yes. And I love what you said about we spend so much time with our coworkers and that we can make their lives better. They can make our lives better too. But I know there's so much about toxic workplace cultures and burnout and dental hygiene. Our students see that and they are nervous to go into the field and
Right.
they get on these Facebook forums and they see all of this just like, don't go into hygiene.
Oh,
It's the
gosh,
worst.
I
And
hate that.
but look at us.
Yes.
Love our careers,
We
obsessed
love
with our
it.
careers and finding ways, to make other people's lives better. In my mind, makes your life better too.
Absolutely.
Yeah.
Absolutely. Whenever I'm giving a class, the last thing I always say is smile at a stranger.
Yeah.
That could be your patient. That could be the grocery store clerk. That could
Mhm.
be someone walking through academy who, had a bad day. But smile at someone because a smile goes a long way. I mean, we
Does.
all deal with our own stuff, right? We carry our baggage to work with us sometimes. We carry it outside of work. But if you can make one small change for yourself every day, Smile at yourself before you go to work every day.
Yes. Oh, I love that.
And smile when you come home.
Yeah.
Look in the mirror and smile at yourself because you know you could have saved someone's life that day.
That is very true. And give yourself a high five. I read something like if you give yourself a high five in the mirror,
I'm gonna
like
do
it's one of
that.
the best ways to, I don't know, I think just kind of have that moment with yourself
Yes.
too.
Yes.
But for me, I decided when I'm having a rough day or I'm not feeling good mentally, emotionally, whatever it is, I'm going to make someone else's day better. Or I'm going to do something nice for someone else. It could be small, like smiling to a stranger, whatever it is, but
Right.
it makes me feel better. And
Yeah.
then it's like this cycle, they say it's a ripple
Yes.
effect that you
Yes.
put out into the world. And I really think that we're in such a powerful position because all we do all day long is spend time with people.
Right.
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 So
Right. Yes.
I love it. Such good takeaways from today's episode. You're probably like, Dana, you didn't cover like any of the questions that we
Oh.
planned for, but I really just like to see where the conversation goes because that's what makes this fun. And
That's
I know that our
right.
listeners will love it. Well, tell
Yes.
our listeners where they can find you if they have any questions.
Yeah, so I am Deanna RDH on Instagram and Deanna Otts-Whitfield on Facebook. I'm also on LinkedIn. Yeah. I work for Copper Penny Consulting, so copperpennyconsulting.com if you want to find me. So, yeah, if you see me at a trade show or if I look familiar, yeah, come say hi.
I love that.
Yeah,
Awesome. Well, thank
for
you so
sure.
much, Deanna. I
Thank you,
appreciate your
Deanna.
time.
Thank you.